Thank you for joining us for this press conference with live streamed and with media availability. We appreciate your participation, and hopefully we can answer some of the media's questions a little later on. As you know, the Prime Minister last night issued a quarantine act, a federal quarantine act, which requires you, with a penalty if you don't do it, to isolate yourself for 14 days if you've traveled out of country and are coming back. Very important step to take, and now actually is law, so you are subject to penalties if you do not do that. The best thing for you to do if you know people that are coming home, is to go directly from the airport to your home and then ask friends or family to drop off some groceries for you and then stay home for 14 days. The provincial enforcement measures are in place for all businesses that are to be closed. The business violations of the provincial order could also be fined by the police. A fine for an individual could be up to $1,000, and for corporations, $500,000. So severe penalties, and that will be followed up by the Hamilton Police in concert with our bylaw officers as well, in terms of how they proceed. And if anyone is aware of a business that is operating that should not be, they could call 905-546-2489 and report anonymously, and it will be followed up on. Still today, prohibited gatherings of more than 50 individuals is still the standard. Less is better. Staying separated and apart in all instances is best, and staying home more often than not is even better. So please follow those general rules, and we will continue to work through these issues. Again, if you see people at 50 or more gathering, you could call not 911, but 905-546-4925, and someone will follow up on that issue and hopefully rectify the situation. Closures to note that have been announced, but I'll just refresh your memory. All City of Hamilton play structures are closed. The signage is going up as we speak to ensure that people do not use them. There's a couple of reasons for that. Firstly is these play structures are not sanitized. You don't know who's been there before, so you could pick up a virus unknowingly. And it is also an opportunity for people to congregate and play together, and kids to play together, and understandable they'd want to, but it's not a good practice right now. We need to stay apart. And so all of those facilities are closed, and the signage is going up. Albion Falls is closed. Not the falls itself, but the viewing area. The water still flows, but the reality is the parking lot is closed on both sides of the street, again in an effort to prevent people from congregating there that shouldn't be. The falls have been very popular, all of them, including the conservation area falls. They are also closed, and parking lots closed. And again, we encourage you not to go there at all. Do not park on the street to clog up traffic. Just don't go there. Find other ways of getting that walk, hopefully closer to home, or maybe on the escarpment trails. It might be better for you. Some non-essential travel up and down the escarpment as well. The stairs, a popular exercise place for many, many people. Far too many people on there at the same time, and so we're asking that, the parking lots on both top and bottom are going to be closed, and we are going to hopefully require people that only need it for work, coming from the mountain to the lower city or vice versa. Everyone else, please stay off of the stairs. Again, the virus could live on the handrails. You could touch that, and you come in too close a proximity to other people to make it safe. And again, the use of dog parks and trails, residents are to keep at least 2 meters or 6 feet apart of physical distance between themselves and others, and that's a very important step to continue to take. They are not closed as yet. In terms of public transit, as you well know, our transit system is working, but still on a Saturday schedule, so much diminished. Certainly the volume has diminished increasingly as well. We've required people to get on the bus using the back door to avoid and protect the driver, and of course, as you know, it's free. But free does not mean go and take a ride just for the heck of it, to entertain yourself. Free means it's to help paramedics and firefighters and all those that need to go to work, frontline service people, that they're able to use the transit system to get to the work that they need to do, or for folks that need to get their groceries, don't have a car, that they can do that and then come home directly. So you're actually potentially infecting a lot of people if you get on the bus and stay on the bus for no reason at all, and you're potentially infecting yourself as well. In terms of social supports, there is a lot going on in terms of social services. A lot of work with the homeless shelters, and residents are being housed in various different locations, including Bonetto. If they're COVID positive tested, they can be sheltered there in a safe environment. That's currently open at the Bonetto Rec Center, and we certainly hope that not too many people have to use it, but if it's necessary, it's available. And lots of other great work going on in that space to provide food security, and additional resources to a lot of the shelters that are struggling to keep up with the work that they need to do. And of course, on the economic recovery front, I'm just going to refer all business people to the website. It's www.hamiltonchamber.ca/COVID-19. On that website, you will find all kinds of resources, including the latest announcements from both the federal and provincial governments in terms of how that might apply to your business and some of the financial offsets that you're able to find there that might help you withstand this shutdown that we're experiencing right now. So on behalf of myself and our city and council, thank you for everything you're doing. Excellent work is happening both at the EOC, the Emergency Operations Center, as well as through public health, and continue to use those resources to get information. And but now, to get more information about what's currently happening, I'm going to introduce you to our Emergency Operations Center Director, Paul Johnson.
Thanks very much, Mr. Mayor, and good afternoon, everybody. Certainly one of the big questions I know that's on everybody's mind is exactly when some of the closures will end. And I just want to let people know that as you heard the Premier say a number of days ago, he does not anticipate schools opening on April the 6th, but was unable to talk about the date or a length of time that closure would continue. We continue to monitor that situation along with the province, and we'll take that advice coming out of the province as well. Much of our activity is tied, particularly around recreation and other activities, to school children in the school year. So we're going to continue to wait, and I know that lots of people want to make plans for what's happening post-April 6th. But I'll ask for people's patience as we continue to dialogue with the province and our own public health officials to understand what will happen next. There has been, over the last day, a number of announcements of financial programs that will assist residents and businesses in this community. And one of the things that we've worked on today, I've seen a draft. Our hope is that by the end of the week we can have it online, is a collated copy of all of the financial support packages that are available for people within the community. And that's all people in the community. There are lots of opportunities. We're not just talking about some of our most vulnerable here. We're talking about supports that are across the board for many of our individuals and families who call Hamilton home. So look for that in the coming day or so. We'll have that online, and as it's meant to be, it's a tool to help people make their way through the myriad of announcements that came from our federal and provincial governments. We have seen tremendous support for the folks that have to deliver service on a daily basis here at the City of Hamilton, because they're essential or critical services for this community to keep going. And I want to say that I really appreciate all the offers that are coming in, how they can support many of the folks that do need to come to work, some of them outdoors, some of them in our buildings, in order to keep the city services going. I also want to commend our staff who have, on a dime and with very little notice, figured out lots of ways to keep our additional city services going from remote locations or from their own home. So kudos to those who are delivering service. I do want to say that unfortunately we've had over the last couple of days a number of disturbing interactions with some of our parking enforcement staff that are out in the community. As I've mentioned on a couple of occasions, our goal right now is not to be enforcing things like meters that run out, surface parking lots where payment hasn't been made, and we've talked about that. However, it is critically important that we continue to enforce parking that impacts on health and safety. COVID-19, for instance, is not an excuse to park in front of a fire hydrant that may be needed for an incredibly more urgent issue if a house were to require those services. So we need to make sure that we're kept safe. And when our folks are enforcing, they're doing so because vehicles are placed in areas that are not safe. So I'm asking the public to have some compassion for the folks that are doing that job. And if you are a bit agitated, we've also unfortunately had people coming into that 6-foot circle, and that interaction can't happen. And so we're trying to keep our folks that are out on the streets safe as well. Be respectful of these folks if you encounter them. I understand the last thing anybody wants is a ticket, but recognize that our enforcement regime now is about keeping everybody safe. We've had a few people that have ventured out onto our golf courses, and I want to remind the public that they are closed. I understand that as the weather warms and the golf clubs look enticing in the garage, the impetus may be there to try and get out on our golf courses. They are closed. The parking lots are closed. You may see some of our city staff, a small number of them, out providing general maintenance on our golf courses. They are doing that in the hope that we will be able to open them later in the season, and we want to ensure that we are able to do that in a good way later on, potentially. So not to be used for golf at this time, and those golf course parking lots will be closed. We have had some folks write in about pedestrian signals. Those are push signals that are required in order to activate crossing lights. And starting today, some of our pedestrian signals in Hamilton will be reprogrammed so pedestrians do not need to touch them to activate the crosswalk lights. The reprogrammed signals will be in high priority, high pedestrian areas, such as near local hospital, urgent care centers, and COVID-19 assessment centers. The reprogramming will ensure that pedestrian lights come on without you needing to push that button. The enhanced accessible audible crossing, my apologies, will still need to be activated manually by those users who require it. So if you do require that audible crossing signal, that will still require a manual push of a button. Other signals that require pedestrians to touch them in order to activate will still need to be manually activated around the city. We are not reprogramming all of them. We are focusing on those that are in particularly high traffic areas or near healthcare facilities. We do know that coming up next week, we were to start some of our spring recreational programming, and many people have sort of signed up for that already. At this time, we have decided that we are delaying the start of our spring rec programming by at least 2 weeks in order to continue to evaluate and determine our go-forward plan beyond that. So rather than scrubbing the entire spring rec program, we are delaying it. And as I say, this is very much to allow us to see what the province is thinking around their school closures as that comes forward. We do want to remind the public you will not see a lot of public communication about this from the city. We are focused obviously on this emergency and our priority work here, but it is worthy of reminding the community that this weekend we do recognize on a yearly basis at this weekend Earth Hour. So certainly commend that to people's own thoughts and considerations, but in terms of hearing more from the city around Earth Hour this weekend, we'll not be providing any updates on that. Thanks, Mr. Mayor, and I think now we can turn to Dr. Bart Harvey for an update from Public Health.
Thank you, Mr. Johnson. So a couple of notes, and then we'll kind of throw it over to our moderator with questions. At noon today, we were up to 43 cases in the city of Hamilton, so that would be an additional 4 cases since I reported at last night's town hall. Also recognizing that early today we became aware of what I believe is our 3rd healthcare worker who has been infected with COVID-19. We're still in the very early stages, working with our partners at St. Joseph's Hospital and HHS to kind of determine contacts, symptom onset, et cetera. So that whole phase is well in stage, but still working through. I'll highlight Paul's recognition and repeating the kind of 6-foot safety zone So for all folks recommending that they stay out of everybody else's 6-foot safety zone and try to avoid others so they're not in your 6-foot safety zone. And one other comment, just the hotline number is 905-974-9848 for Hamilton Public Health. And I would underline anyone that is feeling symptoms, has questions, certainly somebody who feels they need to travel to their doctor, get to the assessment center, get to an urgent care center, and doesn't have their own transportation, or isn't clear about what would be the safest transportation for them to use to make sure that, again, they don't find themselves inside of somebody else's 6-foot safety zone, please don't hesitate to call our hotline. Our staff are more than happy to work with you, find out what your circumstances are, and provide advice and assistance so that you can make that transportation in the safest way possible. I think I'll stop there so that we can open it up.
Thank you, and just to cover off that, you know, we still need you to do your part. It's very important. It's critical that you maintain your distance and stay home as much as possible. All the good advice that we're getting and all the closures we're doing, you know, aren't going to be effective if you don't do your part, and so it's critically important that you do, and we certainly ask you to make sure that you do, and make sure that others do as well. On the screen are the website and the response number for the public health hotline. Some things that you could do in terms of helping out is provide blood. Canadian Blood Services has a shortage. You can go to blood.ca. They'll be happy to make an appointment and provide some of the vitally needed blood services out there that currently isn't being collected the way it has been done in the past. Continue to support your local shops and restaurants and other locations that are doing takeout or pickup delivery. You know, these are facilities that we want to make sure can somehow withstand the closures that are happening in here, and some of them are still allowed to provide takeout. And equally, if you're feeling sad, stressed, or worried, as we all are, but some more than others, you could call a crisis hotline if you're really having challenges. You know, you can call COAST at 905-972-8338, or the Kids Help phone at 1-800-668-6868. They're open 24/7 to take any of your calls if you are in crisis and need some help and attention. And of course, you know, I see many parents are talking to their kids. I think it's critically important. They're equally concerned. They're equally worried. They hear things in the news and may not be as focused on it as we all are, but it's certainly wise for all of you to spend some time helping them understand what we're doing and how we're going to successfully get through this together. So let's crush the curve, and let's keep working together to make sure that we can get through this collectively and successfully as we move forward. I'm going to turn it over to the moderator for questions.
Thank you. So we do have a number of media on the phone. I will just remind everyone on the phone to please keep yourself on mute unless it's your turn for question. I also have a couple emailed questions. We're going to stick to one question and one follow-up, and we'll start with Joanna from The Spectator.
Hi, thanks so much for taking my question. I'm looking to find out how many patients and how many staff that this dialysis nurse worked with.
I take it that's for me. Hi, Joanna. So as I mentioned in my remarks, we're still in the very early hours, literally, of investigating this. So at this point, we don't know that. We're still working with St. Joe's, HHS, and this individual to determine when they became symptomatic, going back now 48 hours as of yesterday's revised public health guidelines. We're using 48 hours prior to symptoms rather than 24, and determining where they were and who they interacted with. So disappointingly, at this point, I don't have an answer for your question.
Okay, thank you. And I also can you talk about the fact that we now have 9 cases of community transmission, which is a pretty significant increase from 2 yesterday?
my statistical colleagues would be loath that you use the S word in such a way, significant. As I mentioned on the town hall last night, I think we've clearly made a turn from the first phase being majority travel, the second phase being majority contact with folks who had travel, and we've now turned the corner, like the rest of Canada, I expect that the majority of our cases going forward are going to be community spread, and that's just the nature of this outbreak and the nature of this virus.
Thanks. Next question will go to Samantha Craigs from CBC.
Hello. Last night, Dr. Harvey, you mentioned that there was a Hamilton family that had 6 COVID-19 cases in it. I'm wondering if you can tell us anything more about that family and if any of them are in serious or critical condition.
Sure. Hi, Samantha. It's one of our earlier cases, and as far as I know from our staff, I mean, quite frankly, at this point, no news is good news, because if I haven't heard about it, then they're progressing along quite nicely. And again, as I mentioned last night, the one thing that we learned back in December from our colleagues in China is probably one of the characteristics, if not the classic characteristic about this virus, is it loves close and prolonged contact. And so clustering in families, if I looked at it, and I haven't had a chance to look at it in detail recently, but I would almost guess that at least half of our cases have links to close contacts, family members, with that one family being, at least for us, is kind of a bit of the outlier, but we've got clusters in families of 3 family members, so it's the nature of this virus, close and prolonged contact.
Just in terms of that family, are we talking about 6 people in one, like in an immediate family, or are we talking about extended family members as well?
I'll talk in generalities, because at this point I start to feel kind of people deserve their privacy, their confidentiality, especially around personal health information. But it would be 6 people who are closely related to one another, not necessarily all living under the same roof, but certainly spending time with one another. So the close and prolonged ability to spend time with one another and contracting the virus kind of in that kind of a setting.
Thanks. Next question goes to Tevye Morrow from The Spectator.
Hi there. I was wondering if Mayor Fred or Paul could speak a little bit about when you expect the arrangement that Jason Thorne, I believe, was organizing to have city council meetings arranged remotely, if that's what's going to happen still, and whether the public will be able to view agendas like we used to be able to do before this all happened.
The answer is yes. They're working up the technology now to have that happen. I can't give you a date specific, but I would say over the next couple of weeks, we will have a system in place whereby the council can virtually meet. Agendas will then be developed, and there'll be a committee outline in terms of which committees are going to meet, and then all the appropriate agendas would be available as they have been in the past. So we're closing in on getting the technology that will allow us to do that, and I would say a couple of weeks on the outside, but soon council will be able to continue meeting with full committees, full GIC, full council at the end of the day on a somewhat regular basis. And I would think that it wouldn't be as regular as we've had it in the past, but it's certainly going to be very similar to the very similar meetings that we've had with the agendas that we previously put out.
I see. A completely different question, maybe for Paul Johnson. Paul, we've heard that the tiered response practice that the fire department has in conjunction with paramedics has changed. Could you speak a little bit about how it has changed and for what reason?
So there have been some changes in certain cases. What we don't want is firefighters and paramedics in close proximity of time with non-life-threatening acuity calls going in, both having to don full PPE. You can recognize that the biggest resource concern across the province and from particularly working with first responders in the healthcare sector is the availability of PPE. We always ensure when we're going into a case or in the case of fire and paramedics to a call, when it's dispatched as a potential COVID-19 case, and that's done through dispatch, that we want to make sure people are protected. So all we've done is re-looked at how fire is responding and when they're responding, and how we can have more paramedics arriving first. Ultimately, the paramedics will have to come in. So this will allow us to do it with the paramedics only, and then they'll have the responsibility for care and also then the responsibility for transport. I want to be very clear, this is the internal workings of how fire and paramedics can work together to deliver effective and efficient care. The public does not need to worry. The right people in an absolute emergency will enter through your door and provide life-saving care, and PPE resources are not going to impact that at all. This is for those slightly lower acuity calls where we will maybe be able to, instead of the very closest available vehicle arriving a couple of minutes earlier, it would be an ambulance instead. But again, those are not for life-threatening calls. In those cases, the public need not worry. And this is a way that we can provide the right care by the right people using the right resources. And, you know, our call volume for ambulances over the course of a day, there are always peaks and valleys, but over the course of the day is lower than usual. We have not headed into as many constrained resource situations. So right now, the situation is that we can have more of their paramedics responding and a bit less of fire responding in certain cases. And those were really decisions made by both chiefs to protect equipment and supplies, but also ensure we still deliver great care.
Thanks.
Next question goes to Dan Takema from CBC.
Hey, Dr. Harvey. I'm looking at the backlog in testing today. I'm wondering if you can give me kind of a ballpark estimate for how many tests are still pending for Hamilton.
Hey, Dan. I wish I could, but that would be our colleagues at the Public Health Ontario lab, both the regional lab here in Hamilton up on Fennell Avenue, and I understand it's also affecting all of the other labs. I think one of the good things is I hear news that the regional lab in London looks like it's ready to come online, so that will be good. That will take some of the pressure off our Hamilton regional lab because we're currently covering that zone as well. But I'm not tied into it. I certainly feel it when we kind of look for test results. And I know that Vanessa Allen, the director of the Public Health Ontario Labs, is very aware of what the challenges are, and they're working very hard to be able to address those and get caught up in the backlog and be able to turn around test results in a much more timely fashion.
Okay, I think you've done this to a degree already, but just to put it in a question, a formalized question, we're hearing from people obviously who are anxious to get their results back, and I'm just wondering if you have any message beyond what you just said to those people.
Well, I have some level of impatience, so I understand that they would have some level of impatience too, and I'm very empathetic with them, and all of us are hoping that Vanessa and Jonathan and their colleagues are going to be able to be successful sooner rather than later, and we'll start to see this backlog go away. But I guess the one other thing I will add, Dan, is the people that have been tested, what we would ask them to do is to continue to maintain their self-isolation until we get their test result back, because until we get that test result back, we don't know whether the illness and the symptoms that they were experiencing are due to COVID-19 or due to something else. And I would even underline, even if they're feeling better now, the fact that they were feeling ill enough, recently enough, to be tested for COVID-19, I would really stress to them that it is very important that they maintain self-isolation until we get that test result back to them.
Thanks, Dr. Harvey. Next question goes to Lisa Pileski from CHML.
Hi there, thanks so much. I believe most of my questions were already asked. I did have I know you can't give too many specifics on the new case with the healthcare worker. Just wondering if you're able to provide sort of a range of gender and age or anything like that. I do know that there are certain regions or municipalities and regions who are providing those details on their websites. So just wondering if you might be able to release any details, as well as whether it was community transmission, this case.
Thanks, Lisa. So the one thing that I am almost solidly sure of is that it's a healthcare practitioner who is serving as a nurse and serves both St. Joseph's Hospital and Hamilton Health Sciences. I think it's the general site. As far as gender, to tell you the truth, since the conversations I've had earlier today, we've come back and forth, and so I think I would be speaking out of turn if I tried to make a calculated guess on that, but it would be clearly somebody who's been through nursing school and has graduated. I think they have some experience, so they would be at least a young adult. And as far as kind of symptoms, where they got it, whether it's community spread, whether it's linked to something else, still too early in, what's the line? This is still an ongoing investigation. And at this point, I really don't have, again, as I said to Joanna, I have disappointingly few details at this point, but hopefully over the next little while, we'll be able to complete our investigation, or at least get further into our investigation and be a little more sure about the circumstances around this case.
Great, thank you. I don't think you're able to comment on whether certain regions of the city or have seen any more of these cases of community spread or anything like that, just in terms of our listeners having concerns about certain regions being impacted more than others?
No, so this really isn't an environmentally linked infection. This is, as we've talked about, this is people who are infected and have the ability to transmit the virus to others. So, you know, my guess is wherever you have the largest concentrations of people, you've got the largest probability of folks doing that. But geographic clustering of cases and infections, it doesn't really work that way.
Thanks. Next question goes to Jennifer LaGrassa from CBC.
Hi there. I think this question would be for Paul, but I know that there was $50,000 supplied in emergency funding. I'm just wondering how much of that went to food banks.
So that $50,000 was earmarked for food share. So all of their resources go to various food programs throughout the community. So we're really lucky in Hamilton. We have an organization whose sole focus is not to deliver service to individuals, but to bulk buy and use their leverage to supply the food banks and meal programs who deliver service to Hamiltonians. So that $50,000 was earmarked for food share. They tend to translate that into many times more in terms of their purchasing power, and all of those resources will go to our food banks and our food programs. And knowing Joanne Santucci as I do, it'll be out the door in a matter of minutes once she's able to purchase the food.
Joanne would also say that donations are welcome to food share if you can provide money that they can then turn into food for the food banks and throughout the community. That would be much appreciated. So I believe it's foodshare.ca you can go to and make a donation directly from your credit card. Every little bit helps for them to be able to provide food and nourishment for some of the marginalized in our community.
And how did the city know how much money to give to food share?
So the city has almost daily conversations. In the case of the shelters, it is daily. We have regular conversations with our providing agencies, and Food Share indicated that to get through the next immediate period, $50,000 would help provide support to those programs. So we're very much taking the cue from the experts who are here. We're also really happy that the province is also going to provide some more money to municipalities that we can then push out to our charitable and nonprofit organizations in this community. And we're getting details on that. It should happen in the next couple of weeks or so. But right now, we're looking at reasonable requests from our partner organizations. And as I say, groups like Food Share are really ones that we go to often because they actually provide it to all the organizations. They have agreements with organizations. So it's a very easy way for us to make an investment that helps many agencies as opposed to taking individual requests from single agencies.
Okay, that's great. Thanks.
Next question goes to Taz Boga from CHCH.
Hi there. This question is for Dr. Harvey, please, and it pertains to the dialysis nurse who tested positive for COVID-19. Realizing that you don't have much information, does this mean any medical staff or patients will need to self-isolate?
Taz, can you repeat your question, just speaking a little bit slower for us, please? And everyone else will just ask you to keep your phones on mute.
So this pertains to the dialysis nurse who tested positive for COVID-19. Does this mean that any dialysis medical staff or patients will need to self-isolate until they're contacted by you or while they wait?
Thanks, Taz. So again, we're in the midst of working very closely with St. Joe's and HHS, and actually I just got off the phone not long ago with their infectious disease lead, and I know that the two hospitals are, because they're much closer to it than I, and they have a great expertise. I know that they're already looking at when this individual would have worked, when they were symptomatic, who the patients might have been involved, which coworkers they would be working with, and their occupational health and safety and their infection control practitioners are doing exactly what you just described. You know, our staff, our nurses, or as they got referred to rightfully yesterday, our detectives are busy in working with St. Joe's and HHS and doing their own work to make sure that that all the right people are identified and as quickly as possible being asked to either self-isolate if they're deemed to be a close contact of a high risk of being infected, or a casual contact. They'll be asked to self-monitor their symptoms for the next 14 days, and at any indication that they're having symptoms, they're instructed to immediately withdraw from and report to their supervisor that they have to leave work, and then they would go into self-isolation and undoubtedly be tested themselves.
So I just want to be clear, until if someone knows that they were there on Friday and could possibly have been infected, should they stay in self-isolation until they're contacted?
So, Taz, it sounds like you know more information about this than I do, which good for you. Again, our staff looking at and identifying what are the time periods in which locations that individuals would need to be self-isolated. My guess is, I'm not sure that I mentioned it was a dialysis nurse, but you have. I would imagine that any family member or any patient that's getting dialysis at either of those sites might already be in self-isolation or certainly trying to ask questions. And again, my understanding is HHS and St. Joe's already are well on top of this and contacting their patients, family members, as will our staff.
Okay, second question. What impact will this have in dialysis treatment services in Hamilton going forward?
So I decided not to pursue a specialty in nephrology. I'm going to have to defer to my colleagues at St. Joe's and HHS who actually have a competency in what's required around dialysis.
Thanks, Dr. Harvey. Next question goes to Katrina Clark from the Hamilton Spectator.
Hi, this question's for Dr. Harvey. I'm wondering about the nurse. The memo said that she started experiencing symptoms on March 21st, but she wasn't tested until March 25th. I'm just wondering why the delay.
Well, again, I think, Katrina, and hello, I think part of the challenge is as we move into community spread. So by what you've described, you know, if somebody doesn't have a travel history or a contact to another person, In the early stages of this, it's not kind of obvious that you're, the notion of, I feel a little off. Did I have a bad night's sleep? So my understanding would be that it would be reasonable that, this person may have gone for a couple of days having very minor symptoms, and then getting to the point. Being tested on a day doesn't mean that necessarily people can be tested the day they present. It might have been they presented the day before to be assessed, were booked in for testing the following day.
Okay, thank you. And my second question, you mentioned that there are 3 healthcare workers who have tested positive. We know the first is the oncologist, the second's the nurse. Who is the third healthcare worker?
So, great question. I just want to be clear. The radiation oncologist that was tested positive back on Tuesday, March the 10th, as it turned out, while they work in Hamilton and they play a very vital role to the Hamilton and the broader health sciences network that the Hamilton serves, she actually is a resident in another region. So in fact, she's not a Hamilton case, she is a case in an adjoining region. And to tell you the truth, I know that from discussions with staff, it's come up, the whole notion, because with the changing protocol yesterday, there are now 2 separate protocols for being able to deem somebody resolved of this infection. And there's a different one for healthcare practitioners. That one still maintains you must have 2 negative tests at least 24 hours apart. The algorithm or the process for resolving non-healthcare practitioners is a different process. So I happened to yesterday, when that came out, turn to our staff and said, do we have any healthcare practitioners? And they said, yeah, we have a couple. So the details on those other 2, I don't have immediately at my fingertips, but I have to admit, Katrina, when I walked through the doors to here, I thought, somebody's going to ask me that, and I'm going to have to say right now, I don't know the details.
Thank you.
So I'll just ask on the line if there's any media who haven't yet had an opportunity to ask their first question. So hearing none, Mr. Mayor, I'll pass it back to you.
Thank you. And if I could, I'll just touch on the funding announcements that the federal and provincial governments have delivered in the last couple of days. Fantastic help for businesses and individuals in our community from the federal government, and equally in terms of healthcare and the homeless and other categories in terms of supplies and direct aid from the province of Ontario. All very positive. 2 negatives in my view would be that I didn't hear anything about supports for renters in our community, and I think that's something that the province at some point will have to address. And with the municipalities declining revenues and increasing expenses, at some point municipalities across the province will also need some assistance in terms of managing these expensive and high costs and reduced revenues going forward. So we thank them for these great announcements, and we look forward for additional ones, because I think we're going to need more to help our communities get through this. I'd like to thank our American Sign Language interpreter for the deaf, Rosalie Vizers and Georgia Whalen, both of whom have been doing a terrific job and getting a great workout every time they do, so I'm envious. And all of you for tuning in. Again, none of this is effective and worthwhile in terms of announcements if you aren't doing the things that you need to be doing based on the recommendations that public health has recommended. So we encourage you all, do your part, and we can get through this together. Thank you.